with many students that have come in contact with doing nursing have actually voiced out that they were not well informed when they got into the particular field that they are studying their nursing in. So I thought it wise to come up with this video to help most people that are planning to take nursing. Hello guys, you're welcome to my channel. My name is Banestine. If you're tuning for your very first time, you're highly welcome. For my returning subscribers, I love you all. Thank you so much for your support. In today's video, we'll be talking about comparing mental health nursing with adult nursing. These two comparison is not a final conclusion, still your passion and what you aim for as an individual plays the most important role to choosing your nursing career. So this is just a comparison for you to know what it entails to be a mental health nurse and what it entails to be an adult nurse. So let's start with just the basic of what is mental health nursing and what is adult nursing. Mental health nursing simply means that you will be taking care of patients with mental health illnesses. And adult nursing goes with all physical health concerns. For instance, in mental health nursing, you are going to be taking care of patients with mental illnesses, anxiety, depression, bipolar disorders, schizophrenia, eating disorders, personality disorders. Those are things that you'll be focused on when you are with mental health illnesses, just to name a few. When you are a mental health nurse. If you are an adult nurse, you will be treating patients with more of physical health concerns. When I say physical health concerns, just to name a few as well, you have things like asthma, you have things like high blood pressure, diabetes, you have lower respiratory tract infection. Name them, all those physical health illnesses that you are aware of. That's what physical health nurses do. However, when they talk about treatment, when it comes to mental health nurses, how do they really manage? How is their treatment more like? The treatment of mental health nurses is more of a talking therapy. So they have more time with their patients to talk one-on-one with the patients to bring, to de-escalate or to help relieve their anxieties, to help relieve their depression. So it's more of talking therapies. When it comes to adult nursing, you do all the medications that you can imagine in this world. You are going to administer all medications that as much as possible. However, in mental health nursing, they also administer medications. In adult nursing, they also do talking therapies, but it's like talking therapies way more on mental health nursing and medication way more on adult nursing. The next thing, what is the route of administration mostly in mental health nursing? Route of administration for medications is more oral and intramuscular in mental health nursing setting, but in adult nursing setting, all the routes of medications that you can ever imagine of, you administer medications with, be it IV, intradermal, intramuscular, subcutaneously, all the routes that you can imagine, you administer the medications with in adult nursing. In mental health nursing, you do things like tribunals, you do things like care coordination sessions, you have one-to-one therapies with your patient. In adult nursing, you have more of, you collect blood physically from your patient, you administer blood, you do ECGs, you do oxygen therapies. Name those procedures that you can imagine. In mental health nursing, you are going to nurse, you can nurse a single patient for a very long period of time. So you can nurse one patient for over 5 years in mental health setting. In adult setting, in adult nursing, you are going to nurse a patient within few days and few weeks, they are discharged and another patient comes in. So adult mental health nursing is more of a prolonged, slow treatment that takes over a period of time for your patients to get better and get discharged. Adult nursing, it's a rapid turnover. You meet patients today, tomorrow you meet other sets of patients. Someone working in the emergency department, I bet they will not meet that same patient the next day, even the next few hours. You come on a night shift, the next night shift you're coming, you can't meet that same patient because it's a quick turnover. Even in the ward, at most you get patients for 1 month, 2 months at most, to get patients that have prolonged stay. You can't get a patient that stays 5 years in that same setting. Probably they might transfer, even if the patient still stays in the hospital, it's easier to transfer the patient to another setting rather than making the patient stay in that particular setting. So that is adult nursing. In mental health nursing, you will find few deaths. So you are going to deal with few death cases. So you are going to have, like, because deaths don't frequently occur, like it's rare. But in adult nursing, you deal with critically sick patients. So you can easily get deaths in your shifts and in your career, as many as. But in mental health nursing, you can barely do your mental health nursing for the period of time that you can do your mental health nursing, maybe for 20 years, 30 years, go on retirement, and you never witness a death. But in adult nursing, there's a probability that, like, almost every year in your career, you might meet a death, especially depending on the ward you are working in. You work in wards like the ICU, the emergency departments, some acute units, you will definitely witness so many deaths. Also now, in mental health nursing, most of their medical cases, they refer them to general hospitals. If they have a mental health patient and the patient, let's say, had something that needs a medical attention, if the patient suddenly develop a seizure, they refer to general hospitals. They start managing it and they see that there's any complication, they take straight to general hospitals for adult nurses to now continue. So in adult nursing, they receive patients from all domains. They are still bound to deal with patients from mental health settings. Or in mental health nursing, there's high risk of assault. So you can easily be assaulted in a mental health setting. Probably because of the patients, sometimes they are really disoriented, they really don't know where they are, their mental condition, sometimes it's easier for you to be assaulted. However, in adult setting, it's less likely that you'll be assaulted. I did not say you can't be assaulted in adult setting, but it is less likely that a patient will assault you in adult setting. So mental health nursing is it affects your brain. You work with your brain more. You go back home and you feel that your brain is drained out. In adult nursing, you go back and you feel physically exhausted and mentally exhausted, but I'll bet you 100% physically exhausted when you are working in adult setting. In the mental health setting, you do more of sitting and talking with the patients. In adult setting, you can be on your toes for a 12-hour shift from one patient to the next, and you don't even have time to sit down and do your notes. I'm not to scare you, I'm just telling you reality. In mental health nursing, there's this aspect of mental health nursing that you need to de-escalate a patient. De-escalating a patient that is agitating, is restless, and is trying to self-harm. You need to place that patient on restraint. You need to first of all try maybe your talking therapist. If it is not going, you now need to restrain that patient. You can now start even on low holds, and finally you can go up to high holds where you are lying on the ground with this patient, trying to de-escalate this patient and prevent self-harm. In adult nursing, I've never seen that. I bet you I had never seen that. But in adult setting, patients can become restless. They are always like, there's a way to stop the patient from agitating, but you will not find like full restraints in adult setting. Mental health nursing, you need to exercise patience. You need to exercise lots of patience. In adult nursing, there's a probability that even if you have less patience, you can survive. That's what I've gathered for you in regarding mental health nursing and adult nursing. So this is what you should think about, the realities and all of this, when you are choosing a career, be it in adult nursing or mental health nursing. So guys, if this is something that you like, why not give a thumbs up to this video? Subscribe to our channel if you are not yet part of this family, and hit the notification bell so that each time I upload a new video, you'll be the first to be notified. Thank you so much for watching. Stay tuned. Bye bye.